Most people with varicose veins move through the exact same sequence. Spider veins show up, you ignore them. The veins get more visible, you buy a cream. The bulging starts, you finally see a specialist, get a referral for surgery. Surgery happens, 2 years later, the veins are back. That is not bad luck. That is what happens when you treat what you can see and leave the cause completely untouched. Here's what almost nobody tells you. Varicose veins are not a skin problem. They are not even primarily a vein problem. They are a system failure, a breakdown in the mechanics of how blood actually moves through your legs. And that failure has specific addressable causes. When you understand those causes, you can do something real about them. If this kind of clear, practical health information is what you're after, subscribe and hit like. It helps more people find this channel, and the goal here at Dr. Waterling is 200,000 subscribers. You're part of getting there. My Telegram channel is where I post health checklists and practical deep dives. Scan the QR code on screen right now to grab them. So let's go back to the beginning. What actually is a varicose vein? A varicose vein is a vein that has stretched out and lost its shape. Inside every vein, there are tiny valves, small flaps of tissue that work like one-way gates. They let blood move upward toward your heart and snap shut so blood can't slide back down. When a valve weakens, blood pools behind it. Pressure builds inside the vessel. The wall bulges outward. That twisted, visible vein under the skin, that is a valve that stopped doing its job. Now think about the physical challenge your leg veins are dealing with every single day. Your heart pumps blood downward through the arteries. That part is easy, gravity helps. But getting blood back up from your feet to your heart, that is a climb of roughly 4 to 4.5 feet in the average adult. Your heart has no direct role in that return trip. The job belongs to two systems, those valves and your leg muscles. Every time your calf muscle contracts, it squeezes the vein like a pump and drives blood upward. The valve closes so it can't fall back. The muscle relaxes, the vein refills from below, the next contraction sends it higher. That is how the blood gets home. If either system, valves or muscles, breaks down, you get stasis. Blood sits still, pressure builds, walls stretch. So what breaks the valves? There are 3 main mechanisms, and most people have never heard of the first one. The first cause is pressure from above. The organs in your lower abdomen, the intestines, the uterus, the bladder, sit directly above the major veins that drain your legs. When those organs are heavy, displaced, or prolapse downward, they press on the large pelvic veins beneath them. That compression creates a partial blockage. Blood trying to climb out of your legs hits resistance at the top and backs up. Pressure throughout the entire leg vein system rises. Pregnancy does this. Chronic straining on the toilet does this. Repeatedly lifting heavy loads does this. Anything that pushes abdominal organs downward adds to the burden your leg veins are already carrying. The second cause is a structurally weak vein wall. Vein walls are made of collagen and elastin fibers, the same proteins that give your skin its elasticity. In some people, those fibers are thinner than average from the start. This is called connective tissue dysplasia, an inherited tendency for connective tissue to be more fragile than normal. People with this pattern often notice unusually flexible joints, a history of easy sprains, and varicose veins that appeared early and spread quickly. On top of genetics, vitamin D deficiency weakens the vein wall because vitamin D is essential to collagen production. A shortage of bioflavonoids, plant compounds that reinforce the vessel wall and reduce its leakiness, accelerates the breakdown further. And chronic low-grade inflammation in the surrounding tissue, often driven by diet, slowly erodes the wall's structural integrity over time. The third cause is thick blood. Blood viscosity, how thick or thin your blood runs, directly affects how hard your veins have to work. Thick blood moves slowly, builds pressure, and stresses the walls. The single biggest driver of blood viscosity in otherwise healthy people is dehydration. Not severe dehydration, chronic mild underhydration that most people carry around every day without realizing it. Now let's get into the 5-step plan. Each of these steps targets a specific part of the problem. Together, they work as a system. Step 1. Improve blood fluidity. The medical term is hemorrheology, the science of how blood flows. Better hemorrhology means lower pressure on vessel walls and lower risk of clot formation. The starting point is water. For someone with varicose veins, the minimum is 30 milliliters of water per kilogram of body weight per day. If you weigh 150 pounds, about 68 kilograms, you need roughly 2 liters. If you weigh 175 pounds, closer to 2.5 liters. And this means water, not coffee, not tea, not juice, not soup, water. Coffee and tea don't count because caffeine is a diuretic. It makes your kidneys excrete more fluid than you took in. The drink goes in, but your body ends up with less water than before. That does not mean you need to quit coffee. It means every cup is a reason to add an extra glass of water to your day. 2 natural substances are worth adding here because they both improve blood flow and act as venotonics, compounds that help vein walls contract and hold their shape. The first is turmeric. Turmeric contains curcumin, which reduces inflammation in the vessel wall, inhibits platelet aggregation, meaning it makes platelets less likely to clump and form clots, and improves circulation in the smallest blood vessels. This is not folk medicine. This is pharmacological research. Half a teaspoon of turmeric added to any warm meal each day is a meaningful therapeutic amount. The second is ginger. Ginger contains active compounds called gingerols and shogals. They reduce blood viscosity, improve flow in the microcirculation, and have a direct anti-inflammatory effect on vessel walls. A documented approach that shows real results in clinical practice. Slice fresh ginger root, pour boiling water over it, add a wedge of lemon, pour it into a thermos, and sip it evenly throughout the day. The key word is throughout, not all at once. That keeps the concentration of active compounds in your blood stable rather than spiking and crashing. Step 2, reduce tissue swelling in the legs. This one is less obvious, but it matters enormously. When the tissue surrounding your veins is waterlogged and puffy, it compresses the vein from the outside. Blood has a harder time moving through a compressed tube. The vein works worse, the swelling worsens, the swelling presses harder on the vein. It becomes a self-reinforcing loop. The worse the swelling gets, the more the vein suffers. Where does tissue swelling come from? Primarily food. There are 3 categories of foods that cause tissue fluid retention, and reducing them makes a real difference. The first is sugar. When you eat sugar, your body stores some of it as glycogen, a stored form of glucose, in your muscles and liver. 1 gram of glycogen holds approximately 3 grams of water. The more sugar you eat, the more water your tissues hold onto. This is not theory, it is direct biochemistry. Sugar also triggers chronic inflammation in the vessel wall, which accelerates its deterioration. The hidden sources most people miss: packaged fruit juices, flavored yogurt, bottled sauces, mass-produced bread. A carton of carrot juice from a grocery shelf typically contains as much sugar as a can of soda. Read the labels. The second is monosodium glutamate and similar flavor enhancers. They disrupt the sodium-water balance at the cellular level. Cells hold on to more sodium, and sodium pulls water with it. The result is chronic, low-level fluid retention throughout the tissues. Where are these found? Chips, crackers, fast food, frozen meals, packaged soups, instant broths, essentially the majority of the center aisle grocery section. The third is dairy. For a significant portion of people, casein, the primary protein in cow's milk, triggers chronic low-grade inflammation in the gut. That inflammation contributes to fluid retention throughout the body. This does not apply to everyone equally. But if swollen legs are a persistent problem for you, it is worth eliminating dairy for 3 to 4 weeks and watching what happens. Your body will give you a clear answer. What to add instead? Foods that support kidney function and help the body move excess fluid. Cranberries and lingonberries are natural diuretics. Blend them with water, no added sugar. Horsetail herb, corn silk, parsley, celery. These can be brewed as teas or found in ready-made herbal blends at most health food stores. In season, cucumber, watermelon, cantaloupe, 80 to 90% water by weight with a mild diuretic effect. None of this is complicated or expensive. It just has to be consistent. Step 3, activate the muscle pump. This may be the single most important step in the whole plan and the most frequently skipped. As described earlier, the muscles of your legs are the engine that drives venous return. Every calf contraction is a pump stroke. If the pump doesn't fire, the blood doesn't move. This is why varicose veins are especially common in people who stand or sit in one position for hours. Surgeons, hairstylists, retail workers, people at desks. 8 to 10 hours with the legs stationary means 8 to 10 hours with the venous pump essentially switched off. Blood sits, pressure accumulates, walls stretch. There is a persistent myth worth addressing head-on, that people with varicose veins should rest their legs and avoid exertion. This is not just wrong, it is harmful. Controlled physical activity is not a risk for someone with varicose veins. It is part of the treatment. The exercises to limit are heavy barbell work with breath holding and prolonged hard running on pavement. Rhythmic leg movements that repeatedly contract and release the leg muscles, that is medicine. Here is a 3-exercise sequence documented in rehabilitation practice to activate the venous pump from top to bottom. Exercise 1. Sumo squat for the pelvic floor and inner thigh. Stand with your feet wide apart, toes turned outward. Lower yourself as far as your anatomy comfortably allows. Rise back up. 10 repetitions. The wide stance engages the inner thigh and glute muscles that govern venous drainage at the pelvic level, the top of the venous highway leading back to the heart. Exercise 2. Standard squat for the thighs. Feet shoulder width apart, toes forward. Lower to about parallel and stand back up. 10 repetitions. Pay close attention to your breathing. Inhale on the way down, exhale on the way up. Holding your breath during a squat sharply raises intra-abdominal pressure and creates exactly the kind of downward force on pelvic veins that makes varicose veins worse. Exercise 3. Calf raises for the most powerful pump in the leg. Stand upright, slowly rise onto your toes. Hold for a second at the top, lower slowly. Continue until you feel a mild burn in the calves. That burn tells you the muscle has been thoroughly engaged and the pump has fired. This is the venous pump in direct action. The full sequence takes 3 to 5 minutes. Do it at least 3 times a day. If you work at a desk, stand up every hour and do at least the calf raises right at your workstation. Take the stairs instead of the elevator. That counts. Walking in general is one of the most effective things you can do for your veins. 30 to 40 minutes of walking per day produces measurable improvement in symptoms within 2 to 3 weeks. Step 4. Clear the mechanical obstructions. This is the part of the plan that almost no one discusses, and it is often the reason why vein problems keep progressing even when someone is doing everything else correctly. Here is the anatomy. Surface veins in your legs drain into deep veins. The deep veins of the lower leg travel upward, pass through the back of the knee, become the femoral vein in the thigh, pass through the groin, become the iliac veins in the pelvis. The 2 iliac veins merge into the inferior vena cava, the body's largest vein. That vein travels alongside the abdominal aorta, runs past the intestines, passes behind the liver, penetrates the diaphragm through a dedicated opening, and empties into the right side of the heart. That is a long journey, and along that path there are at least 5 anatomical locations where external pressure can partially block the vein. If even one of those points is obstructed, pressure builds in everything below it. No amount of exercise or hydration overrides that upstream blockage. Point 1. The groin and pelvic region. The femoral vein passes through a narrow anatomical channel. Right next to it on the right side is the cecum, the beginning of the large intestine. On the left is the sigmoid colon. If there are adhesions, chronic inflammation, or a chronically bloated, gas-filled bowel in that area, the vein is compressed. Blood cannot drain properly from the leg. Point 2. The small intestine. The loops of the small intestine occupy most of the abdominal cavity. When the small bowel is distended, cramping, or has dropped lower than its normal position, it creates pressure on the iliac vessels. Chronic constipation, irritable bowel syndrome, persistent bloating, these are not just digestive annoyances. They are structural forces acting directly on the vascular architecture of your legs. Point 3. The liver. The inferior vena cava passes directly through liver tissue. An enlarged, congested, or fatty liver displaces the vena cava and creates partial resistance to blood flow. Fatty liver disease is not only a story about liver enzymes and metabolic risk. It is also a compressive factor in venous circulation. Point 4. The diaphragm. The diaphragm is the dome-shaped muscle that separates your chest cavity from your abdomen. The inferior vena cava passes through its own dedicated opening in the diaphragm. When the diaphragm moves freely with each breath, that rhythmic motion actually assists venous return. It creates a gentle suction effect that pulls blood upward. When the diaphragm is chronically tightened, which happens with prolonged stress, poor posture, and sedentary living, that opening is compressed and venous return is impaired. What do you do about these obstructions? You work on them directly. The technique is called visceral massage, manual mobilization of the abdominal organs performed either by a trained practitioner or with proper guidance by the individual themselves. Gentle pressure applied to the cecum area on the lower right and the sigmoid colon on the lower left can soften adhesions and relieve tension around the vein. Slow, circular, clockwise massage over the central abdomen improves intestinal motility and reduces pressure on the iliac vessels. Gentle, sustained pressure just under the rib margin on a full exhale addresses diaphragm tension and restores its range of motion. These changes build slowly. Adhesions that took years to form do not dissolve in a week, but they do respond to consistent, patient, daily attention. And once the mechanical obstacles begin to clear, everything else in this protocol becomes significantly more effective. Step 5. Strengthen the vein wall itself. While you address the mechanical factors, you also need to give your vessel walls the raw materials they need to stay resilient. That means correcting two common deficiencies. The first is vitamin D. Vitamin D is essential to collagen synthesis, the production of the structural protein that makes vessel walls strong and elastic. When vitamin D is low, blood vessel walls become less flexible and more prone to damage. The majority of adults in northern latitudes have chronically low vitamin D, especially from October through April. A blood test for 25OH vitamin D gives you the number. The optimal range is 50 to 100 nanomoles per liter. If you're below that threshold, this is worth discussing with your doctor, because correcting it under medical supervision matters here. The second is bioflavonoids. Bioflavonoids are a class of plant compounds that directly reinforce the vein wall, reduce its permeability, meaning they help it hold its structure and not leak fluid, and reduce inflammation throughout the vascular tissue. Natural sources include blueberries, black currants, tart cherries, chokeberries, citrus fruits, and buckwheat. This is not incidental. The two most widely used pharmaceutical vein strengthening medications, diosmin and hesperidin, are derived directly from bioflavonoids. Getting these compounds from whole food sources results in better absorption than from supplements alone. A quick word on compression stockings, because this question comes up constantly. Compression garments, stockings, knee socks reduce pressure in the surface veins, decrease swelling, and relieve discomfort. That is genuinely useful, but the moment you take them off, the veins are back under full load. Compression does not address a single one of the underlying mechanisms that created varicose veins. Use it as a support tool, especially during long flights or extended periods of standing, but not as a substitute for actually addressing the cause. On the subject of surgery, laser ablation, sclerotherapy, phlebectomy, these procedures work. They remove the damaged vein effectively. The cosmetic result is real. But if the cause has not been addressed, new veins will develop alongside the treated area. This is a pattern that comes up repeatedly in clinical records. A patient has a successful procedure. A year and a half to 2 years later, they're back with new varicosities on the same leg. The surgical result was technically correct. The underlying system was not corrected. Surgery is a valid and sometimes necessary tool. It is the final step, not the first one. If you reach surgery having already done everything else in this protocol, there is a good chance one procedure holds for years rather than months. Now, about blood clots, because this fear lives in many people's minds, and some of it is well-founded and some of it is not. A clot forming in a varicose surface vein is called thrombophlebitis, inflammation of the vein wall with a clot inside it. The signs are distinct. The vein becomes hard and cord-like. It hurts when you press it, and the skin over it turns red and feels warm. If you notice those signs, see a doctor within the same day and get a duplex ultrasound of the veins. Duplex ultrasound is a specialized vascular ultrasound that shows not just the anatomy of the vein, but the actual speed and direction of blood flow inside it. Based on that result, a physician can determine whether anticoagulants are needed. Here is the important distinction. Pulmonary embolism, a clot traveling to the lungs, is a complication of deep vein thrombosis, not surface vein thrombosis. Varicose veins are surface veins. They are anatomically separate from the deep venous system that connects to the lungs. A clot in a calf varicosity very rarely leads to a fatal embolic event for this reason. The condition that warrants serious vigilance is deep vein thrombosis, particularly after surgery, prolonged immobility, or flights over 8 hours. Varicose veins do carry some elevated risk, but it is significantly lower than the scenarios many people imagine. Do not ignore warning signs, but do not amplify the fear beyond what the physiology actually warrants. One important age-related factor to keep in mind. After 50, the rate at which varicose veins progress accelerates. This happens for 2 reasons. In women, estrogen levels drop, and estrogen plays a direct role in maintaining the elasticity of blood vessel walls. In both men and women, muscle mass steadily declines after midlife. Less muscle means a weaker venous pump, which means more blood sitting still in the veins. The clock on this does not stop, but it can be slowed significantly with the right daily habits. How old are you? Leave your age in the comments. It shapes what specific recommendations are most relevant for where you are right now, and it helps me build future videos around the audience that's actually here. So here's the full plan laid out clearly. Water. 30 milliliters per kilogram of body weight each day, every day. Add turmeric to warm food, and drink ginger tea sipped throughout the day. These are daily habits, not occasional additions. Food. Reduce sugar, avoid monosodium glutamate and packaged ultra-processed foods. Trial a dairy-free period if leg swelling is a persistent problem. Add cranberries, lingonberries, horsetail, parsley, celery, and fresh seasonal produce to support natural fluid clearance. Movement. 3 times daily. Sumo squats, standard squats, calf raises to the burn point. Stand and move every hour. Walk 30 to 40 minutes a day. Take every set of stairs available to you. Abdominal work. If veins continue progressing despite the above, investigate the mechanical obstructions. Work with the groin, intestinal, and diaphragm areas through visceral massage, either with a practitioner or with proper guidance. This is slow work. Do it every day. Nutrient baseline. Get your vitamin D tested. If it's low, work with your doctor to correct it. Eat bioflavonoid-rich foods consistently. Blueberries, tart cherries, citrus, buckwheat. Emergency signal. Pain, hardness, and redness along a vein means see a doctor and get a vascular ultrasound the same day. Varicose veins are not a condition you simply accept as permanent. They have causes. Those causes are addressable. The process can be slowed and, in earlier stages, genuinely reversed, but only if you work on the system that produced it, not just the vein you can see. Everything here is for your information and education. Your health picture is individual, and the most useful conversation you can have is with a clinician who knows your full history. If this video gave you something real, subscribe and leave a like. That is how this channel reaches more people. 200,000 subscribers is the goal, and every person who subscribes moves it forward. My Telegram channel has checklists and health posts you can actually use. Scan the QR code on screen to find it.